Wache, and welcome. This is Anne from the Sioux Lookout Practice Consultant Team, and you're listening to the Practice.Support podcast, the one and only show that discusses new practice updates and changes for ISC's Ontario region. Coming to you with acknowledgement to the Anishinaabe Algonquin Nation, whose traditional and unceded territory this podcast is recorded on, and with respect to the different traditional Indigenous territories of Turtle Island that this podcast may find you. Hello everyone. Today we have Annie, a registered nurse and one of the practice team members since February 2022. Her background previously as a CHIN is in Pikangikum and has been an ER nurse in various rural and urban hospitals from New Brunswick to British Columbia. Welcome to the show, Annie.
Thank you for having me.
So what would you like to speak about today?
So we will be talking about the pediatric DKA algorithm and emergency clinical care protocol today. A little background in diabetes incidence to start though. According to Diabetes Canada, Indigenous peoples are diagnosed with diabetes at a younger age, have more severe symptoms when diagnosed, face higher rates of complications, and experience poorer treatment outcomes. There are many barriers that affect the care that Indigenous peoples receive. These impact the frequency and ability of people to manage their diabetes well. These barriers include fragmented healthcare, a lack of culturally appropriate care, poor chronic disease management, high healthcare staff turnover, chronic underfunding of health services for Indigenous communities, and limited tracking of new diabetes cases. These inequalities also contribute to the main risk factors associated with the development of type 2 diabetes and its complications.
Now, you mentioned diabetic ketoacidosis at the beginning there. Are there some factors or complications you would want our listeners to consider?
So diabetic ketoacidosis is a complication of new or existing pediatric diabetes and may be complicated by cerebral injury. Due to this risk, it is treated differently than adult DKA. Healthcare providers must follow a recognized pediatric-specific protocol when treating pediatric DKA. Early communication with the diabetes specialist or pediatric intensivist at your referral site is a key element of the management of these patients. Dehydration is a key component of the DKA pathophysiology. All patients with DKA should receive a 20 ml per kilogram bolus of normal salines or Ringer's lactate over 20 minutes at the initiation of treatment, which can be repeated if the patient still shows signs of hypoperfusion. Ongoing fluids in DKA should be weight-based and account for the significant fluid deficit, which you will see in the TREC-guided, protocol-adapted, and available to our nursing stations. Every patient in DKA is at risk of cerebral injury before and during treatment, so they should be monitored for signs and symptoms, as well as follow the TREC-DKA algorithm, which we will review briefly here. The TREC-DKA resources have been recently updated to reflect the 2022 International Society for Pediatric and Adolescent Diabetes Guidelines.
Well, TREC is a really helpful resource. I'm glad we've integrated that into a pediatric DKA algorithm. Now, is there anything else you'd like to specifically highlight in that DKA protocol for peds?
While the adapted DKA protocol is available and easy to use and interpret, you can also find the TREC algorithm. This tool will help guide your assessment and identify the signs and symptoms, as well as analyze your findings. From recognition of DKA symptoms to initial case management and cerebral edema signs and helpful management bullet points. These patients can be very sick, but remember that you are not alone in managing these cases. They can require many simultaneous interventions, so try to work with a partner if you can, and remember to contact the consulting provider promptly for guidance. The available resources have the necessary information and are easy to locate. You can also read more about DKA in the Clinical Practice Guidelines in Adult Chapter 10 under Metabolic Emergencies. The takeaway here is that in pediatric DKA, fluid resuscitation in the initial stages of management is the priority treatment and is of utmost importance.
That's a really good point, Annie. Where else can nurses turn to if they would like to read up a little bit more on PEDS DKA or just DKA in general?
So you can find the TREC Pediatric DKA algorithm as well as the FNIB Ontario Region Emergency Clinical Care Protocol on One Health under the Nursing tab in the Pharmacy section under Diabetic Ketoacidosis under Resources. Please, however, keep in mind that this is a guide, not a medical directive or any kind of authorizing mechanism. You must consult with the appropriate provider before initiating. There is a reminder noted on the protocol for you as well.
That's a great point, Annie. Thank you for being here today and going over the points of pediatric DKA protocol.
Thanks for having me.
thank you all for listening to the Practice Support Podcast. If you're keen to follow up on any of the information you've heard today, head on over to One Health and iTacit, where you'll find more links and resources. For more practice updates, don't forget to find and follow us on our Instagram, Facebook, and YouTube channel at SLKT.Nursing.Practice.Support. And as always, if you have any questions, please reach out to a nurse practice consultant, an education practice advisor, or your manager. That's all for this episode, folks. See you at our next podcast.